Okay, so again, we're planning to put a 4.8 implant. So I'm going to go to the final drill, which is the 4.8 drill, which is the purple or the magenta drill. And again, we want to go to the top of the bevel, but yet we don't want to perforate the sinus membrane. So I'm going to stop a little short because I can feel it. I already went through the floor. And you can see how nicely everything fits in there. And then we'll take an X-ray just to see where we're at. Okay. Okay, so you can see that the implant is okay. Let's take an X-ray. Alright, so we'll get an X-ray here. Are you okay? You alright? Not too bad, huh? Okay, so now we can see that the implant is right up to the sinus floor on the X-ray. And I'm going to need just a few millimeters of lift. So I will do what we call auto lift, which means that I will just need to, all I'm going to do, okay, if you only need 3 to 5 millimeters, as you can see, we should be on the top of this blue line right here. We should be right on the top of this blue line, or the black line, right here at 12. 6, 8, 10, 12, 14, 16. So we should be right at the top of the blue line. But you must remember again, we need to be at the top of the blue line at the crest of the bone and not at the soft tissue. So we're at the soft tissue, and you can feel that membrane bouncing. So we need 3 more millimeters at least in order to get at the crest of the bone. So in this case, in order to just get 3 millimeters of lift, we'll use the instrument called the auto lift instrument number 4, which looks like a golf putter. And all we do is place it and hook it on the bone and spin it 1 time around, 2 times around. And what that does is it gives us automatically 3 more millimeters of lift. So now when we place the measurement tool, we should be able to get further down. Okay, so now we're at 15. Perhaps maybe a little bit more. So we can try it again with the auto lift instrument. Just swing it around, keep it on bone, 1 time around. Okay. And if we need more lift, then we start manipulating the membrane with the one instrument. The one instrument goes in, hooks over the ledge, and again, keeping the tip on bones, so spinning it around. Other side. And again, you should be able to get as much lift as you want manually with this instrument. Okay. So again, using the measurement tool, we're almost at 16. Okay. So let's get some bone graft in there. Bios. Again, I'm just spinning the JMY4 instrument just to free up some more space. Okay, now we're going to be adding some bone graft in the socket. So I do it simply with just 2 instruments. I get the bone graft on 1 instrument, and I just place it in the socket or near the socket and use the other instrument, Pritchard elevators, to push it in. And that's it. The bone graft's in the socket. Then we get the number 4 instrument again and use it to pack. So you spin it, you jiggle it, and you wiggle it so it spins inside the lift that you did. And you can place more bone graft. As such. Condense it if you want. And if you want to even pack it with the drill that you finally use, you can vibrate it in. And then we can take an x-ray. Okay? Okay, I may have a 4.8 by 10 millimeter implant now. 4.8 by 12, I'm sorry. 4.8 by 12 millimeter implant. Okay, so right before we place the implant, some cases if you want to make sure that the implant is situated far enough down, we'll go ahead and use the countersink. And we'll see if the countersink even stops. If it does, it'll give you a good stop or a good placement of the implant. Again, we want that line to be 3 millimeters below the lowest point, which is going to mean that we want at least the tissue to bury, or tissue to cover up a little higher than the actual base, because this is where you want the implant. This is going to be 3 millimeters above it. So we want to countersink it a little lower. So as you can see, we don't see the countersink any longer. This is about how deep we want to be. Okay. Alright, so now we're going to be ready to place the implant in. Before we place the implant, if you want to put some bone graft at the end, you can. Okay, the implant comes sealed up in these containers. Oh, okay, so you can open it up. See the implant in there. Simply take the implant out of this vial, take it to the mouth. Try not to touch anything on the side of it, and the implant should just go freely in. And where it should stop is at a level about 3 millimeters below the soft tissue. So if you take the carrier, if we go back and look at the carrier on the implant, it has a line, and the line is based on where the soft tissue and the average is, which is 3 millimeters. So it needs to go down a little further, which we can now torque down. So now we take the torque wrench and we place it in, make sure it's in first. And we can torque it down, and we can see how sturdy it is. So you don't want to over torque it. You just want to make sure it's deep enough. And so now we know by looking, we can actually look at the top of it, that we are about 3 millimeters from the tissue.